Today was purposely chosen as a difficult case. What we're faced with in this case is a circumstance that I think more realistically we're faced with every day for the patient that comes in that has been aesthetically compromised as a result of dental work that has failed, maybe as a result of functional problems. And what you have in this case is a patient who had at one time had tetracycline staining, and at one time many years ago had veneers and some crown work done. This is a pretty typical scenario that we would see in our practice. And so the challenge that it presented was really twofold. One, we knew that there was defective aesthetic work that had been there for many, many years. All we're interested in is really kind of creating a custom tray. And the formulation of the heavy body along with the light body, there's going to be a nice chemical interaction between those two where the light body will bond quite nicely to the heavy body that we're lining the tray with. What I'm going to do is final contour of just smoothing the facial surface and making sure that my line angles are where I want them. And what I like to do is to, as I'm doing the posterior quadrants, is I like to get in a position where I can look right down this quadrant and focus on the cuspid all the way back posteriorly. And it enables me to really develop accurately the proper golden proportions so that you can see the mesial half of each posterior tooth as you go posterior. And what this does is gives the effect of broadening the smile of the patient, particularly one who has had bicuspid extraction and whose posterior segments or buccal corridors are deficient. So we've in essence built that out and given her a broader smile by using that technique.